In previous two videos we have discussed about introduction to ANS, then sympathomimetics. Now in this video we are going to discuss about sympatholytics, which means adrenergic blockers. As we know, in adrenergic systems there is two types of receptor, that is alpha and beta. So blockers are also of two types mainly, that is alpha blockers and beta blockers. First one is that is adrenergic blockers. It is mainly classified into two class. First class is non-equilibrium type, under which one class is beta haloalkylamine, in which there is only one drug, that is phenoxybenzamine. Then next type is, or next class is equilibrium type. First one was non-equilibrium type. Now second one is equilibrium type, in which first is non-selective. Non-selective is further classified into four types, out of which first one is ergot alkaloid. Ergot alkaloid contains ergotamine and ergotoxin. Then next class is miscellaneous, in which there is only one drug, that is mainly chlorpromazine. Then third class is imidazoline, in which there is phentolamine, which means it contains imidazoline nucleus in its structure. Then last one is hydrogenated ergot alkaloid. These are only the dihydro form of ergot alkaloid, as we can see, ergotamine in ergot alkaloid and dihydro ergotamine in hydrogenated ergot alkaloid. And same one with next, that is dihydro ergotamine. Here is one mistake, that is dihydro ergotoxin it is. Then first one was non-selective. Now second one is alpha 1, which means it mainly shows action on alpha 1 receptor, in which there are mainly 5 drugs, that is prazosine, terazosin, doxazosin, alphazocin and tamlozocin. Now we can see here one common pattern or character, that is all the alpha 1 selective blockers ends with suffix zocin or ocin, so we can easily remember it. And last class is alpha 2 selective. It contains only one drug, that is oembin, which is of natural origin. Now this was about classification of alpha blockers. Now let's see about actions of alpha blockers. First one action is on heart. On heart, it decreases cardiac output, then decreases blood pressure, decreases heart rate, and also decreases force of contraction, which means it shows bradycardia action, that is negative chronotropic, negative inotropic and negative dromotropic effect. Next one is on lungs. On lungs, it causes bronchoconstriction, means constriction of bronchioles. Then on uterus it causes relaxation. On eyes, it causes meiosis, that means constriction of pupil, while alpha agonists were showing mydriasis, that means dilation of pupil, and it shows opposite, that means meiosis, that is constriction of pupil. Next use is on bladder. It causes contraction. Due to this tendency, it is used in treatment of benign hypertrophy of prostate gland. Then next use is it blocks ejaculation during intercourse. Then on metabolic system, we can say it increases LDL and decreases HDL. LDL, that means low density lipoproteins, and HDL, that is high density lipoprotein. Due to as we know, LDL, that is low density lipoprotein, is dangerous for health, and HDL is good for health. It is doing some opposite thing, so it may be dangerous. Then last one is on kidney. It decreases renal blood flow, then glomerular filtration. Then it results in more absorption of sodium from body or water. Then this was about action of alpha blocker. Now uses of alpha blocker. First use, that is in hypertension. For this mainly two drugs, that is phentolamine, which is from imidazoline class of equilibrium type. And next second one is phenoxybenzamine from non-equilibrium type, that is beta haloalkylamine. Then next is secondary shock. For this, phenoxybenzamine is administered in intravenous, it means in emergency case. Then next one is papaverine or phentolamine are used to induce penile erection therapy for impotence, that is papaverine and phentolamine. Then next one is that is in pheochromocytoma, that means tumor of adrenal gland. In diagnosis purpose, phentolamide test is performed. Then provocative test, that is histamine, methacholine or glucagon are used for this diagnosis. Then for therapeutic, phenoxybenzamine is drug used for pheochromocytoma. Then next is on congestive heart failure. For this, prazosin, that is alpha 1 blocker. Then next is benign hypertrophy of prostate. For this, alpha 1 blocker and 5 alpha reductase inhibitor are used. The example of 5 alpha inhibitor, that is finasteride. So 5 alpha reductase enzyme is it helps in conversion of testosterone to dihydrotestosterone. So this inhibitors blocks the conversion of testosterone to dihydrotestosterone. The example is finasteride. Then till now we have seen about alpha blockers, that means its classification, uses and action. Now it is about beta blockers. Beta blockers, first type is non-selective, that is mainly on beta 1 and beta 2, means it show action on both beta 1 and beta 2. First one is that is without ISA, which means intrinsic sympathomimetic activity, in which mainly three drugs are propranolol, sotalol and timolol. Then next is with ISA. First three was without ISA. This is with ISA. It is pindolol. Pindolol is partial agonist, means it shows submaximal effect. As we know that agonist shows maximum physiological effect, while antagonist shows reversible effect, while partial agonist shows submaximal effect. Third class comes, that is even though it blocks beta receptor, but additionally it has one activity, that it also blocks alpha receptors, in which the drugs are carvedilol and labetalol. Now for this three class was from non-selective. Now we will see about cardioselective, which means mainly on beta 1 receptor. We know that there are two types of beta, mainly there are three, but talking about lungs and heart, in heart there is beta 1 and in lungs there are beta 2. This in cardioselective includes atenolol, acebutolol, betaxolol, bisoprolol, celiprolol, ismolol, metoprolol and nebivolol, in which acebutolol is partial agonist, as we have seen earlier. Like pindolol, it is also partial agonist, which means it shows submaximal effect. And then come ismolol, it is ultra short acting beta blocker. Then come nebivolol, it is nitric oxide donor. This NO, that is nitric oxide, is responsible for vasodilation. If we to identify cardioselective easily, if we see the pattern, we have arranged it in alphabetical manner. See from A to N, except carvedilol and labetalol, that means Cl. All beta blockers whose first letter is between A or A to N, they are cardioselective, except carvedilol and labetalol. We can cross check here also, that is propranolol, it comes under NP. Then sotalol, timolol, it also comes after N. So this was classification. Now we will move towards action of beta blockers. First one is that is on heart. It causes bradycardia. We know bradycardia means negative chronotropic, negative inotropic and negative dromotropic. Here it decreases force of contraction, that is then decreases blood pressure and increases TPR. TPR means total peripheral resistance. Then next come metabolic system. It blocks lipolysis, therefore decreases LDL or HDL level in the body. While alpha blockers were increasing LDL level and decreasing HDL level. Now next one, that is it main use is on eye, that is to treat glaucoma, in which it decreases rate of aqueous humor production. Further, in next video we will cover about glaucoma. Next one is lungs, that is on respiratory tract. It causes bronchoconstriction, increase airway resistance. These beta blockers are contraindicated or they are mainly cautionally used in asthma patient, because in already asthma in asthma patient is troubling for breath, and if they constrict the bronchioles it may worsen the condition of asthma. Therefore they are preferably they are avoided only. Then next come in kidney. As we know, one beta receptor is present in JGA cell, that means juxtaglomerular cell, which is responsible for renin secretion. While blockers decreases the renin secretion, it is also one mechanism to treat hypertension. Therefore beta blockers are used in hypertension. Then next is anti-anxiety action. For that also beta blockers are used. And final one, that is uses of beta blocker. First one is on cardiac use. For that, as we have discussed, it is used to treat hypertension. There is a different mechanism to treat hypertension. Then is angina pectoris, cardiac arrhythmia, myocardial infarction, and congestive heart failure. Next is essential tremor. For that, non-selective beta blockers are used. In classification we have cover about non-selective beta blockers. Then next is pheochromocytoma, that is tumor of adrenal gland. For treating pheochromocytoma, it is used with alpha blockers, but alpha blockers are given prior, means nearly 30 minutes prior to beta blockers. Then next is glaucoma. In glaucoma it decreases aqueous secretion. In one separate video we will cover about glaucoma. Then next is thyrotoxicosis. In thyrotoxicosis, beta blockers inhibits the peripheral conversion of T4 to T3. It is a different part of endocrine system. Then next is dissecting aortic aneurysm, in which it increases cardiac contractile force and aortic pulsation. This use is mainly related with aorta, that is it is present in heart only. Then next is migraine. In migraine, mainly propranolol is mainly used to treat prophylaxis of migraine. Then next is anxiety. For treating anxiety also propranolol is preferred. Then last one is some important points regarding beta blockers. First one is that is bucindolol. It increases HDL level, that means it increases high density lipoprotein level in body. Then next is ismolol. It is shortest acting, we have covered it in classification also. Then next is nodalol. It is longest acting. Then sotalol. Even though patient is suffering from kidney disease or his or her kidneys fail, this drug can be used safely in renal failure also. Then next is beta blockers with membrane stabilizing action. It includes labetalol, acebutolol, and propranolol. Then next is beta blockers are contraindicated in diabetes. And one more point, it is also nearly contraindicated in asthma also, as we know what the reason. Then beta blockers are used in asthma with special care, because even though that alpha alpha blocker is cardioselective, but at high dose it act as non-selective, so they are used with special care. This beta blocker characteristic, that means membrane stabilizing action, this is beneficial in treating arrhythmia. So beta blockers are one of the important class in anti arrhythmic drug.